Hi, I'm Megan Norman. I'm a Minneapolis newborn and family photographer, a mom of three, and I know firsthand how overwhelming the internet at 2 a.m. is when you're a mom and you just need a straight answer. That's why I created Made for Minnesota Moms, real conversations with Minnesota women who support pregnancy, birth, motherhood, with resources that you can actually use. My guest today is Dr. Michelle Haggerty, a physician, advocate, and founder of Fourth Trimester Doc, a pioneering in-home medical practice right here in Minnesota dedicated to postpartum, newborn, lactation, and perinatal mental health. She is board certified in family, integrative, and breastfeeding and lactation medicine, and has made it her life's work to transform the fourth trimester into a time of real healing and support for mothers and families. Dr. Haggerty, welcome.
Thank you so much, Megan, for having me. I'm so excited to be here.
Oh, I'm so excited. I asked you, and then I just kept digging in, and I was like, whoa, 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 this is a totally different experience. It's so tailored. I am beyond excited for more people to learn about what you do and all the things. So before we dive in, can you introduce yourself and who you are, what Fourth Trimester Doc is, and how you built it?
Yeah, absolutely. Well, I always like to start with I'm a human. Like, I'm an advocate. I am an adventurer. I love chocolates. I am an individual myself, right? So I love to travel. I love to, I've got a husband that I adore dearly. And so I'm sort of a human as an individual first. I'm a mom. I have three boys, 8, 6, and 4, and 2 angel babies that I lost along the way, who are still so much a part of my life. They are still sort of looking over me every day, and were such an inspirational part of really my journey. So I'd love to sort of talk about that as well, and I'm happy to talk about my losses too. I think that's such an important part of so many people's story, and really so much a part of what. I mean, a lot of people unfortunately keep quiet about, and it's not something that's talked about enough, in the fertility journey itself. So I'm love talking about my angel babies too. And then I am a physician, as you mentioned. So I started in family practice. I'm board certified, and did a fellowship in integrative medicine, and also in breastfeeding and lactation medicine. So I have this very sort of unique skill set around that really sort of hones in on postpartum, really. I'm also a yoga instructor. I'm a Reiki practitioner. I do a lot of work in mind-body medicine, influence-based stress reduction, like sort of a lot of alternative medicine modalities that I definitely use and hone in on when I work with patients and clients. And so I started Fourth Trimester Doc 5 years ago. It's almost 6 years ago, actually, now in 2020. So COVID, like right at the beginning of COVID, is when this sort of practice was born, and really the vision
that
of
was
it started.
Challenging.
Oh, yeah, exactly. Yes. But honestly, that's where it started, because I didn't feel like people should be going into the clinic. I thought, this was a space where people were very vulnerable and should not be. I was like, we do not need the newborns and the, newly postpartum mothers to be in the clinic space and exposing themselves to people who are sick and very sick. Right. And so, why couldn't we just do this at home in their home space? And so, I dreamed up this practice, and I like to tell this sort of small story in how it was really birthed. Was a great friend of mine came to me and said, "Hey, can you be my baby's doctor? I want to bring them into the clinic to see you, and so I'm pregnant, and I'm so excited." And I sort of took a step back and a deep breath, and I said, "Oh, I can't. I don't feel comfortable with you coming into clinic to see me there, because I don't like who I am there. I don't like the way I practice medicine. I'm burning out. I don't like the sort of like seeing patients every 10 to 15 minutes.
Yes.
You deserve better than that. And I don't want you to see me in that light." So I was sort of like embarrassed about like what it could have looked like if she had come to see me there. But I had already sort of come up with this vision of what, this practice that I thought would be amazing. And so I was like, oh, I don't know, but I'll just pitch it, you know? So I threw it out to her. I said, well, I've got this vision of this practice that, you have your baby and I come in like a day or two afterwards and you're snuggling in your jammies, skin to skin in your bed. And we just come in and I get to snuggle in bed with you and we light some candles and you tell me your birth story and we check over baby together and, everything comes to you and we bake some granola and so we granola baking in the kitchen and all these things. And I just like, what do you think? And she's like, oh my God, sign me up.
Yeah, it's magical.
I was like, this was what I envisioned. This is what I dreamed. I wanted, in my postpartum. And, why would I have to leave the home when
you don't have to leave your house, pack up baby. You're not still
Right.
feeling yourself. I mean, just to have someone come to you exactly how you described it. You don't have to worry about getting ready, making sure you have everything for your baby, let alone if you have another child that you need to also bring along. I mean, just to have someone come to you and it feels that much more safe and comfortable. And I feel like because we are in there, we know we only have so much time. It's like rapid fire questions. And a lot of times I feel you leave there and you're like, I didn't even get to ask some of the questions because I forgot. So to have that experience, I mean, just sounds, amazing.
Yeah. And that was exactly like, at least in my postpartum, when I had, they were telling me that I need to bring my baby in to get the weight checked and, do the initial assessment. I was still in diapers myself. Like I was still incontinent. I was still I was like putting on a pair of jeans sounded like the worst thing humanly possible at that moment. But yet I had to sort of sacrifice again, for my baby, which is, of course we do. Right. But but it just felt like my body was just this vessel and nobody cared about what happened to my body and what I was trying to deal with. And then the whole focus was on this baby, which I loved and I wanted everything to be good and my baby be healthy and things. That wasn't the issue. It's just, I wanted somebody to acknowledge the fact that I had gone through this incredible physical, mental, all things transformation and it wasn't being acknowledged. And so that was where I felt the major gap was happening.
And I don't feel like sometimes as moms, we even realize we want that because we are so focused on our own baby. And it's having someone say that to you. You deserve to be pampered. You deserve to be cared for. Your body just went through this huge transformation to create this amazing being. Like, I will never get over how powerful it is when you look at this person that you created, but like you created them, your body did that. And so it's just as important that you see someone this is just mind blowing. And I'm so glad that you created the practice because it's what we all need or want, but maybe don't even realize that it's there or that someone created it.
Well, that's the thing. We create these humans from our bodies, which is so incredible. And they still depend on our bodies even afterwards. So it's not like once they're out of our bodies that's done, right? So, if you're breastfeeding or body feeding, they're still depending on you for nutrients in that way. They're still waking up at all hours of the night and all hours of the day. And you need to be there and be present for that, right? And so how do you, support this human being and their growth and their development, their nervous system is developing and they depend on your nervous system in how they develop, right? If you are on edge and you are not getting the support you need and you are not healing and you're just barely treading water, then it's not helpful for anyone, right? Your baby's not going to thrive. You're not going to thrive. Your family's not going to thrive. And we deserve support. We deserve acknowledgement of what our bodies went through and continue to go through, throughout that postpartum.
Yes. Okay. So I feel like this is a great segue into not only do you offer in-home care and you're seeing patients for more than an hour, plus you also, from what I saw, only take 200 patients a year. So tell me more about this, why you chose to do this. And even if you want to go into what do your visits look like or how do you structure them, that I think that would be really interesting.
Yeah, absolutely. And it's not really a strict cutoff around 200, but it's really only a couple hundred patients a year total, and that was what our practice takes on. And we do that intentionally. If I don't know if many people probably don't realize, but they're pediatricians and family practice physicians typically carry panels of 2,000 to 3,000 patients. So, which is like wild. So if you're wanting, individual care and you're wanting to be able to reach out to your physician for support, can you imagine? That's why they're not able to answer the My Chart messages. That's why they don't take a week or several weeks, or months even to get in, for appointments with them. Or that you're then, pushed off to somebody else to see instead of seeing your own doctor. It's why that people aren't feeling like they're being seen when they go into the clinic, because well, at least when I was in the clinic setting, it was so hard to be managing 3,000 patients and trying to remember what each individual patient and their story was. And that to me is really critical, because each person, again, as I started, is an individual, is a unique human being with their own story beyond the medical diagnoses, and beyond where they are in their healthcare journey, right? And so I really felt like people were getting lost in the system, which is why I was saying with my good friend, I didn't want her to get lost in the system as well, within my care, because it just is impossible. It is absolutely impossible for a physician to keep up with that. So to me, in order to have a practice that really acknowledged the individual and their journey and their changes, and being able to be available for people, I wanted to limit it, and I wanted to make sure that we were only seeing a certain number of patients and having a certain number of patient visits a day, and a smaller panel. So that's why it was important to me. And then that meant we could have longer visit times. That meant that we can text after hours. So people, or any time of the day, really, people have access to us directly for text messaging, and I usually respond within 15 to 20 minutes, but sometimes an hour if I'm in with another patient. So yeah, can you imagine being able to text message directly with your physician instead of having to send it through a nurse line and then getting, playing this telephone tag with a physician that maybe is just like, well, I'll just schedule an appointment. Well, I would really love some support now because I'm worried about my baby, or I'm worried about me, or, I get messages all the time. Can I take this supplement? Can I, the baby's been crying, all morning. Is there something that I should look into, or is there something I can try? And I can quickly respond and address it. And then, decide later if we need to be, seeing them later that day or maybe the next day. So get quick access to visits then too. So there's a lot of things I think was really important. Yeah, that was missing.
Yes. Well, because I know as a mom, there's so many times you call, you leave a message, then you are strapped to your phone, making sure that you don't miss when they call you back. And heaven forbid you miss when they call you back, because if you call them back, they're not going to answer, which I totally understand. I'm not criticizing that, because I know, like you said, they're seeing so many patients, they're getting so many phone calls. But I just think about, like, as a mom, you're trying to take care of other people, you're trying to take care of baby, all of the things. So to have that peace of mind, to know the moment that question pops up, you can just ask that question, know it's going to get answered, or soon it's going to get answered, and you're not even tethered to your phone. Like, it's again, I feel like all I say on this podcast, but it's magical. It's magical.
Well, that is magical. I also think about, like, so when we, one of the major things that come up postpartum is like the scary thoughts or the intrusive thoughts that people have. So we get these like wild thoughts that come up. Oh, what if I fall down the stairs and throw the baby over the banister? Or what if I, walk around the corner and crack baby's head around the corner, on the corner of the counter?
You see it.
All things that you've never done.
Yes. Yes. It's crazy.
Yeah. You've never done these things before. I've even heard, like, oh, what if I trip over this rug and throw the baby out the window? And I'm like, have you ever tripped over that rug before? And they're like, no, but like, this is our brain that is doing everything possible to try and protect these babies. And these, like, humans that we love so much, we want to do all that we can to make sure that they're safe. So our brains come up with these wild scenarios of what happens if,
Yes.
and it can make you feel insane. And a lot of times it comes up in the middle of the night, right? So these
Yeah.
concerns where then what do? You turn to Dr. Google and you start Googling, like, what happens if, or what am I supposed to do for, or what, especially with babies breathing, right? Is babies breathing normal, and, all these things. And
That's seriously the
and so-
worst. How many times we
Yeah.
check on them to make sure they're still breathing is insane.
Yes, exactly. And then they stop for a second, and then they kind of just, and then they come back again. You're like, oh, are they? What just happened there? And so yeah, exactly. So all these things come up, and especially in the middle of the night. I remember with one of my scary thoughts was something around like hip dysplasia. So I was worried about if I carried my baby, in the carrier wrong, is their hip going to pop out of place, and it's going to be this awful thing. So I was like Googling the exact appropriate way for like the positioning of the baby, which I mean, like, yes, you need appropriate positioning when you do the baby carriers, but it was like to the extreme, I was trying to find the exact position, and I'm like, what is happening right now? And it's because our brains are so tired, and they're also on overdrive on trying to figure out how to navigate protecting these babies, that we come up with all these different scenarios. And so for me, then being able to be accessible, then so coming back to the accessibility piece, people can text me and say, hey, I'm worried about this. I don't know if this is a scary thought that's coming up. I don't know if this is, can you just help me sort of,
process it,
figure this out a bit, right?
Yeah.
And so it can be an easy, quick way of just sort of dispelling that fear,
just nipping it right away.
Exactly.
So
then it doesn't become this ruminating thing where they're thinking about it, or Dr. Googling all night, and then they're not sleeping.
Yes.
And then when they're not sleeping, then the whole spiral happens, right? Because now the mental health starts coming into play. Now they're more anxious, more depressed, more, struggling to just sort of function, when really it came from the scary thought that really could have been, sort of dispelled right from the beginning. So I just think that there's so many places in this space that we can really help people get to a point where they're not feeling like there's the treading water, trying to do it all on their own. They're able to have somebody else on their corner saying, nope, you're doing okay. You're good. This is good.
And that's been a theme now for all of these interviews. It is crazy about just like meeting people full body, like knowing how many different support systems there are out there that really do support women in postpartum, and how important it actually is to feel supported, not only for them to feel supported, but their partner to feel supported as well too, because it is so new. This is awesome.
Yeah, and actually, let's talk a little bit about the partner, because I think that's really critical. Postpartum depression and anxiety and all, sort of the mental health stuff isn't just in the maternal side. It also happens in the paternal side, right? In the dad or the partner. And that we talk about the maternal side not having enough acknowledgement and being underdiagnosed and undertreated, but the paternal side, the partner side, is vastly worse, right? They do not go out, and check and get the care and support they need. They don't really understand what's happening, and a lot of them aren't even connected into the medical system in general. Like they're like, oh, I haven't seen my doctor for 5 years or whatever it's been. They don't even know who their doctor is.
Yes,
because they've been healthy, they've been sort of like doing their thing, and it just hasn't really come up. So, that is something that I've actually found as sort of a side benefit of what, I do, is that now the partners know me, and they know that they can reach out to me as well. And I warn them, and I say, there may be, because it usually happens around 6 months or so postpartum, there may be a point here that you start feeling off. You might be finding more anger. You might feel like you need to be more distant from your kids or your partner. You may feel like you're not able to go to work, or you're focusing too much on work. So we start talking about the things that may come up, and then they can reach out to me, and they know that they can reach out for support then. So then they're not struggling, because then that again reflects the whole family.
Yep. Yeah, it is. Every piece is important in the family. And I think that's such a good point with your partner. Your partner is trying to support mom, trying to figure out baby, trying to figure out other kids, to know that you have the support. Because what I say to my husband all the time is, I want you to take care of yourself and be healthy because I want you around as long as I can have you. So please go to the doctor. Please do things to take care of yourself because that's only going to benefit the rest of us. And I think that when you have kids, it's a new balance, right? You're trying to figure out how to make it all work. That is such a good point. So I would love to know when most new moms get their 6-week checkup and then they're on their own, like from your perspective, what's actually happening in mom's body and during those first 12 weeks, and what do you do differently? Yeah. How do you approach that? Yeah,
Yeah.
exactly.
So first of all, I think the 6-week visit is a joke. I think it's you either like by 6 weeks, either you're barely holding on, or you've sort of figured things out in many ways because you've had to. You're sort of like you haven't had any support between the birth and that 6-week time frame, and so much has happened in those first 6 weeks. Either breastfeeding or body feeding is going well, or it's not, and you just like you didn't get the support you needed, and now it's done. Or the mental health piece is sort of raging, and you're barely hanging on from that perspective, or you've kind of coasted through okay and you're doing all right. And so like, what is happening at that 6-week visit that really makes a difference besides somebody prescribing birth control, to be honest? And that feels like the very big focus of that visit, right? Let's make sure you don't get pregnant again now, but then like, but I'm not even having sex. I just like, there's nothing.
Like, am I even
barely
able
feel like
to?
myself. Right.
Yes.
Like all these things, right? Or the other one is, we can go back to exercising. Like, what does that mean? And like, well, what is happening here, right?
Hannah talked about in her episode about how important it is. This bounce back culture is terrible. We're still nourishing this human more than ever. And so we need to still be supporting our body. You just made this human being, and like your body is different now, and that's okay. Like, love on it, and and don't feel like you have to be back to a certain size, which I know is easier said than done because you want your body back to a certain extent. Like, you just want to feel quote unquote normal, but like that doesn't mean that you have to. Yeah, I just feel like, ugh.
And that 6 weeks is not a magic number. There's such a transition that, I mean, you can start, focusing on your body and your breath and your recovery immediately after the birth. It does not have to wait until 6 weeks and then all of a sudden now you go and start running. Like there's this whole transition that happens, and everyone's body is different, and it depends on what the birth looked like, what your pregnancy looked like, what your physical, exercise routine and all the things look like prior. All of these things are is unique again to each individual, and that's why I will swear up and down for pelvic PT. I think that is incredible and really important for every single human that is pregnant and has birthed a baby in some way, shape, or form. Whether C-section or vaginal delivery, both benefit from pelvic floor PT. I think that's really, really critical. And I actually encourage people to start during pregnancy so they are ready even to work immediately postpartum with somebody again to connect back with the body, to connect back with the pelvic floor, to connect back with the core, so then we can work on moving through and sort of recovering in a very healthy way. So I think that is critical. But so the big things there's so much stuff that happens postpartum, right? And again, like the 6-week, 10-minute visit is just, it's wild to me. And again, the recommendations that typically come from that are very odd to me as well. So my focus is right from the beginning. And the what I sort of lean into is this term matrescence. And I don't know if you've heard of that term before, if anybody's talked about it before.
I saw it on your website. I clicked on it to understand what it was. So please explain, because it's, yes.
So matrescence, it rhymes with adolescence. So that helps with people kind of being able to say it. But it really sort of resonates with adolescence. So it's very similar. So in adolescence, we go through this major transformation, right? Hormonal, physical, societal, relational, how we relate with other people, spiritual, like there's so many things that shift in adolescence. So we're pretty well, versed in the medical field about what happens. And there's whole specialty areas in this as well. Matrescence is another major transformation with, again, all of those similar changes, the physical changes, the psychological changes, the relationship changes, like how we relate to our partner, how we relate to the baby, how we relate to our own parents, right? How we relate to our friends shift, our friend groups shift. The financial changes, like how do you even approach your finances is different. Environmental, how maybe now you start eating organic, or maybe you start being more focused on you're worried about the water supply or whatever because you're worried about your own kid's future, right? So there's all of these shifts that happen, and it's this major transformation that is just really, again, not acknowledged because you can't address all of that in a 10-minute 6-week visit. No. So that's where we start. And so when when I'm meeting with people, we address those things. We address those things as they come up, and also preventatively. So we talk about what to expect as things are moving forward. Your sleep, how your sleep is going to shift. What to expect with the baby, nutrition, mental health side of things, like what is normal and what is and those scary thoughts. And those scary thoughts are very normal. And because you don't like those scary thoughts, it's actually preventative for psychosis. So you don't need to worry about somebody. You need to take your baby. So talk about it. We need to get that out into the world, right? Decreasing that stigma around that. What are the scary things that you do need to watch out for? So what are the things that I want to hear about, or that, we want you to go to the emergency department immediately for? So we really, we get those referrals in. So the pelvic floor PT, the mental health therapist, the doula, if they haven't already had a doula during their pregnancy, getting a postpartum doula involved, or a night nurse, if people have those resources. So we talk through, and we look at each individual situation, each individual person's situation, and figure out in the family, right? And look at how best to support them in the space that they're at, and what that journey looks like. And that journey shifts over time, obviously. So then we kind of shift as we go.
That's amazing. Because it feel like it's like a one-stop shop. Because you are well connected, you know who you recommend, you just know what you're looking for, all these things that so often during these conversations, or just in life in general, someone will say something and you're like, that's such a no-brainer, but I never thought about that. Like, duh, I should have, like, why didn't I think of that? Like, that's the common sense, but you just don't, because there's only so much. To really sum it up, a lot of times I'm like, when more new information comes out, I feel like information falls out the other side, because I can only store so much information in my brain.
And we're so overwhelmed, right? There's so many things that are happening. So how in the world can you keep up with it all? So that's where that support is really critical. So you have somebody that's looking out for you as well, right? And really being sort of aware and holding space for the changes, and so you don't feel like you're just trying to figure it all out on your own. It's not necessary. You don't need to do that.
No, the village is so true. We do need a village. We just do. We need our people, so that we can.
And Minnesota, we're so blessed here. We have so many incredible practitioners in this space. And I didn't appreciate it, honestly, when I was in the sort of clinic system, because if you weren't in Epic, which is our electronic medical record system, people weren't getting referred to them. So so I didn't know about all the incredible mental health therapists, the pelvic floor physical therapists, the doulas, lactation consultants, all these people. It's such a rich community here. And I love meeting with people. I do networking meetings every week with new practitioners, so I can learn about them and learn about what makes them tick, and what specific clients they work really well with. So then when I meet with my patients and my clients themselves, then I can say, this one's a really good one for you. This person, or this clinic situation or whatever is I think will be a good fit because of this, and this, because of these unique features or whatever.
Doesn't that feel good? I love connecting people where this person is going to be your person. Just based off of what you're telling me, you have all the connections, and it's community over anything else. And it's wonderful. Okay. I have a question, backing up a bit. I know you see them with it being fourth trimester, Doc, but when do you start seeing moms or families? When do you want them to reach out? How does that look?
Yeah, that's a great question. I usually start to see them during the pregnancy. So I do a pregnancy planning session around in the third trimester, typically, where we sit down, we come into their home again, and we say, what is your postpartum going to look like? How do we set this up so you are set up for success right from the beginning? So that we're not trying to piece together things afterwards. Like we have a really solid foundation going into postpartum. My doula, when I was working with her 8 years ago, had said something to me that hit home for me so much. She was like, planning for the birth and not postpartum. It's like planning for wedding and not the marriage, right? So it's planning through the events and not for the actual meat of what is, life afterwards. And that's, yes, the event is big and there's a lot of things that happen, and there's, we do want to have some planning around that. But honestly, the biggest meat of the planning needs to be happening postpartum, because that's when you really have more control, and you have really more, sort of say in what's happening, and you have more ability to make some adjustments. So, I think that is just absolutely critical. And it's really where I've leaned into, because I do think it's so important. So we talk about nutrition, we talk about sleep, we talk about the relationship changes, we talk about all this matrescence stuff. So that then people, where's the baby going to sleep? Where are you going to sleep? What's your environment going to look like? You're going to spend a lot of time in this room or this bed. You want things around you that you love and that feels really nourishing and cozy and hygge. I love the term hygge, the coziness from the Danish term. So I really think that is, what we want to be, soft, snuggly, low lighting. Set up your Netflix for funny shows that you can watch in the middle of the night that you're not going to get stuck to. Really prepare so that you are able to sort of navigate the waves of what happens postpartum. So we start there. And then after they give birth, and they send me a little photo, and yay, baby's here. And I say, yay, awesome. And then we typically see people within 24 to 48 hours after the birth. So that's why it's also important to have that, start things during the pregnancy, so that we know when to sort of expect things happen postpartum, or when the birth is going to happen in general.
Are you going into hospital? Are you going
so when they come home from the hospital? Yep. Okay. So when they get home from the hospital, yeah. Okay. I have gone into the hospital before if they're having trouble with lactation or other issues, and for whatever reason aren't getting the support they need. But but usually we wait until either after they've done the home birth and just 24 to 48 hours, or after they get home from the hospital. So that's why the 48 hours typically with some people who have been in the hospital. And then we do all the baby checks, the mom checks, the birthing person checks, all the things. And then we support them all the way through with lactation, with the mental health, with sleep, with, all the shifts that happen. Relationship changes. We talk a lot about ways to support the relationship, how to get back into community with other parents and other moms, and really sort of, help work through that journey as things come up. And hopefully for the most part, things just sort of are pretty smooth and we sort of navigate things very quickly as, if there's anything that comes up that's a problem. If problems develop, usually we can manage it in the home. So, blood pressure issues we can manage in the home. I've even done breast abscess drainages in the home. I've done where they'd otherwise be going to the hospital for a surgery and they'd be separated from their baby. We can do it just right in the home. Bilirubin. So we'd like the treatment for jaundice. We can check and manage it in the home as well. So a lot of things that we would otherwise send people back to the hospital for, we're able to continue to do in the home, which is really beautiful too, because then people aren't separated from their babies. Yes. So then we just kind of continue through. We continue to provide. We continue to do, checks every couple weeks or a week or whatever. It's each individual's needs. Typically, it's about 5 visits postpartum. And then when they do we do their 2-month well-child check. So that's typically you do a well-child check around 2 months, and people get their vaccines if they want to at that time. And we'll do the vaccines in the home as well.
Oh,
so their first set of vaccines are. So their first set of vaccines is they get all their questions answered. They get to snuggle their baby during and after. A lot of babies do really well because they're not plugged into a car seat and then into these like fluorescent lights and all these things. They're just snuggled with their parent, and we just do it really quickly, and it's
This is amazing.
I mean, it's really incredible how little they even cry.
Yes.
Like I've had a number of babies that kind of like squint a little bit and then just, okay, whatever. So it's really
Well, and
lovely.
you're in a safe space. You can breastfeed, you can take a beat, you
Hmm.
can do all the things. You're
All the
not
things.
in a hurry.
Yep.
Or, like, I know a lot
Mm-mm.
of times it's another person that's coming in to
Hmm.
do the vaccine. So to just be
Right.
able, this,
Yeah.
like, come on,
Yeah.
why
And
didn't
again,
I
we
know
allow them,
about
we
you?
are, yeah. Well, and we
Why?
support people breastfeeding, or if they are breastfeeding, to breastfeed during the actual vaccine itself, because it actually
Smart.
helps with pain management. So I know when I was getting my babies my own or their vaccines, I was, even though I knew all the goodness about it, I was like, this feels challenging. This is very hard to like sort of, vaccinate your child and know that you're
Yes.
causing them pain,
Mm-hmm.
even though you know in the long run you're preventing a lot of pain and suffering and all the things. And so yes, it's challenging, but it's important. I will say we also don't require vaccines either. So if people are not
Okay.
interested in doing vaccines at all, it's not something that like doesn't allow them to be in our practice. I don't believe in
Okay.
forcing people to do anything that they don't feel comfortable with. So we're absolutely supportive of everyone's health journey.
This is amazing. Wow. So, what are some things that moms normalize that they shouldn't necessarily normalize?
I think a major one is just that they need to be suffering postpartum. That postpartum needs to be this just horrible, challenging, awful experience.
Right.
Just like making it through, just sort of, barely hanging on. It doesn't need to be like that. It can be very much a beautiful, wonderful, supported experience that doesn't need to be this very challenging sort of situation. The mental health stuff, if people are getting, feeling like they can't rest and they're just, getting up and getting ready and doing all the things and making sure their house is all clean, and they're going to Target and they're wearing makeup and like all this stuff postpartum. I'm like,
Doing too
wow,
much.
there is, you can't settle. Your body is not allowing you to sing. Your mind is not allowing you to settle. And that is also not normal, because people are
Right.
sort of celebrated when they're out and about and doing all the
Go,
things
go,
and,
go.
whatever. And yeah, when they're at Target again, 3 days postpartum, like wait, let's talk about this. There's something going on here, right? So that can be something that comes up quite often. That breastfeeding is painful. Like it should not
Oh,
be painful. It's
yeah.
uncomfortable in the beginning. There's things that baby's trying to figure it out. You're trying to figure out. There's things that sort of happen in the early transition period, but it should not continue to be painful and should not pinch and should not be. So people sort of grit through. They have these nipples that are like
Good point.
practically falling off. They're just
Yes.
lesions and bleeding and all this stuff. And they're like, I'm just trying to do it. And I'm like, wow, there's so many things we should have done prior to this to try to get you prevent this from happening, right? And really help you in being able to reach out to the lactation or us, so that then you have the support that you need. So yeah, so people are sort of gritting through. That's what I see a lot, is the gritting
That's a
through
good
of
point.
whatever it is, whether it be mental health, physical recovery, pelvic floor pain, or
Yeah.
continuing urinary incontinence. Oh, I continue to pee my pants. No, like that, you should not continue to pee
Yes.
your pants. Like that's not normal.
Right.
The feeling of like, that you don't feel like you've got a bulge in your, in your pelvic floor area. That's not normal. Constipation, hemorrhoids, all these things. Like it happens and it's treatable, and it's things that we can support, so that then you don't have to continue to grit through and have to navigate it long term.
Such a good reminder. Such a good reminder. Because again, per usual, moms put kids first because we're only as happy as our least happy child. And so we just do it. We just do it,
Yes,
right? And
right.
so,
Yes.
this is such a good
Mhm.
reminder. Okay, so because I know everyone's going to want to reach out to you. So, what is the best way to reach out to you, and how can they find you, learn more, all the things?
Yeah, so learning more, we're on Instagram at Fourth Trimester Doc, like spelling out fourth, FOURTH, Trimester Doc, DOC. So Instagram, Facebook, TikTok, we're on like all the social media channels. With that, you can find us on our website, www.fourthtrimesterdoctor.com. Go to the contact page if you're looking for support. You fill that out, and it gets sent in to our assistant, who then works through and gets you connected with the different docs that work in the area. We've got Three other physicians besides me currently in our practice. One is out on Marina and St. Croix, and then there's one in sort of Brooklyn Park, Brooklyn Center area, and the one in Plymouth. And I'm in Plymouth as well. Basically, we cover all the Twin Cities area.
Amazing.
Yeah, so we're sort of
It's great.
we're happy to be able to support even in the greater Minnesota area. I've definitely supported people up in Duluth and Bemidji and sort of all over virtually. So we're able to do virtual support as well, which is actually pretty amazing. What all we can
Yeah.
do in that respect. So yeah, so we're here and we are we're happy to be able to field questions and get people connected with what they need.
Ah, you are amazing. This is amazing. I'm so glad that you trusted your gut and did it. And this is magical. It's so cool. Okay, so we've been ending with the what I call real life rescue kit. It's 3 quick questions that are Minnesota specific. So the first one is, what's your go-to takeout spot when dinner is just not happening? And if you want to name it and also name what do you like to get from there?
Yeah, absolutely. So, so I actually moved to Plymouth 2 years ago, and my favorite is in South Minneapolis, and it's Italian Eatery, which
Good
is an
choice.
incredible, Italian restaurant that during my pregnancies I would go in and get takeout there all the time. Really, any pasta that's on the menu, you can't go wrong. It's
Love it.
all amazing and delicious. And I can't recommend it enough. It was walkable distance to where I used to live, and it was just incredible. So.
Perfect.
I was sad when
Okay.
it closed down, but then it opened back up again, so it was good.
It is really good. I would agree. Okay, the next one is, what's your kid-friendly outing in Minnesota that's actually worth it?
So I 100% hands down, and I recommend this to anyone that's having visitors even coming to the Twin Cities, is Minnehaha Falls. The falls
Good
is
choice.
absolutely incredible. It's gorgeous. We are so, so, so lucky to have this in the Twin Cities. You can go hiking. I've brought all my babies. There's a beautiful playground there. There's a pavilion where they have live music, and they always have like sort of art fairs and things in the park. Eastelt Eatery, which is a restaurant right there that's sort of an open air restaurant, is only open in the summer, and it's got the most amazing seafood, which is funny when we're talking about Minnesota, but they have really, really great food. Kids, you can stand in line, get a drink or ice cream and have the kids all run around. And it's really a lovely, lovely place. We always used to bike there when we lived in South Minneapolis, at least once a week. And it was just wonderful.
It's amazing. And actually, my favorite spot for photos is Longfellow Garden, which is just across the street from Minnehaha Falls. It's this wonderful community garden and has a free parking, and it's just beautiful. Okay, and
We're
then my
so great.
last
Yeah.
question is,
So blessed to have
oh,
so many parks in our area. So it's really great.
yes.
Yeah.
That are maintained. It's wonderful. What is a local resource you find yourself recommending to moms all the time? But let's be honest, you are a plethora of knowledge on all of this stuff. So I'm
So
sure it's really hard.
Yeah, I really struggled with that because I was like, I can't really, I mean, there are so many incredible pelvic floor PTs. There's so many incredible mental health therapists, doulas, lactation consultants. I am constantly referring to various people for all the things. But one thing I think that is sort of missed or maybe not really addressed enough and identified the importance enough is that like the new mom groups, the groups where
Yeah.
people have a sort of regular community where you're meeting with new parents with your baby. And so you have like sort of facilitator and they help you actually not only have the groups in the group space, but then also you go out into the community once a week and meet your same new mama group in the community, which helps you be able to feel comfortable and confident in the community with your baby. So whether you're breastfeeding or you have a blowout or something like all the things
They
happen,
understand.
it's hard to be out in the community as a new mom, as a new parent with this sort of newborn, and you're trying to navigate, you don't want to, bother anyone or whatever. And you sort of, when you show up with a group of other parents in the same space, and you can kind of just be right, and you
Yeah.
sit in the restaurant,
Yes.
and you're there. It's really powerful, and And they know everything that's going on with you and the shifts that are happening. And so Amma Parenting, AMMA, is a really, really great resource in the Twin Cities. They have new mama groups, they've got second time mama groups, they've got roly-poly groups, they've got all these different groups that you can be a part of. And I'm still connected with my new mama groups for my kids. And one of them's 8 years, right? So it's been a long time. But we can still reach out and say, hey, how are things? Like, things are shifting or whatever, and get advice. And it really is so critical to have that sort of, again, that tribe that we're talking about. And then you can lean on each other for resources too. So then they know somebody who would refer to somebody or whatever too. So, so it's a really, really great resource center.
That's really good to mention because I found it really beneficial for all three of mine. With my first one, I feel like it was a little different just because she was my first. But I found most beneficial is that you're all in that same phase. So like you can have friends who have kids, you can ask them questions, but a lot of times when you've moved on to the next phase, which sometimes you don't even realize that you've moved on because baby just does their thing and you move on. But to have someone who's in that same spot with you to ask those questions. And I really liked the ECFE classes in our city too. And those were really beneficial for all three of mine too. My third COVID hit in the midst of his group. So to have that community was just amazing. So that's a really good
Yes,
reminder.
thank you for talking about ECFE too, because that is, yes, so critical. It's such a really great resource and very affordable and accessible. And each community has them too. So it's really the community centers and things are really great places to lean into too. Yeah.
It's just nice. It's just good to have more people around, right? The more people you know, the more supported and hopefully just more connections. Dr. Haggerty, thank you. Like this was
Thank you for having me.
like so fun and so informational. I didn't even know that you existed or everything that you offer. Thank you.
Thank you. Thank you so much for having me. Yeah, this was really, really fun. And I really appreciate being able to have this conversation. That's good.
Me too. Thank you. Thanks for listening. And now for my quick disclaimer, the part I have to say out loud. This interview is for educational and informational purposes only and isn't medical advice. For guidance that fits you, talk with your healthcare provider. Thanks for listening to Made for Minnesota Moms, and I can't wait for the next interview.